You are welcome to my channel. We are rounding up as per cervical cancer, and the focus today will be on how to make the diagnosis of cervical cancer. Okay, why do we need to have diagnosis of cervical cancer? Pap test results will be the guide sometimes. Sometimes it could be human papilloma virus DNA testing results, and could be clinical signs and symptoms of cervical cancer. The goal is to determine whether there is cervical cancer or there's none. But first thing first, we must rule out pregnancy. We must report the findings to the appropriate unit, like OBGYN specialist or oncologist. Some will have had Pap tests done before now, which is great, and some may be presenting with signs and symptoms of cervical cancer without any history of Pap test or human papilloma virus DNA testing. So, if the case is such that this is the first time that this woman is presenting no Pap test results before now, then we must start from history, the age, the relationship activity, the age of onset of the first relationship, number of partners, safe practices or not. Any Pap test done already, we've known she's not, right? The results obtained, of course, someone who has never will not have any results. Any sexually transmitted infection or infections. Last menstrual period. Pregnancy symptoms. If she's unsure of last menstrual period and pregnancy symptoms, later on we can have human chronic gonadotropin test done, right? Heavy menses, spotting in between, pain during relationship. You can check my channel for full presentation on cervical cancer signs and symptoms. Still on history of cervical cancer in this patient before might be, maybe precancerous level or stage 1A or 1B already treated. Any vaginal discharge, smoking history, married, occupation. If you're wondering why this, check the full presentation on risk factors associated with cervical cancer. The past medical history of allergy, because of some of the investigations that will be done, some will be allergic to contrast and so on. Medications already taken, hospitalization, surgery, and anesthesia, because you might need to give some anesthesia before you have some, bimanual pelvic examination done. Now, physical examination, general inspection, pallor, mood, caucasic, swollen lymph nodes, vital signs like pulse, the BP, the respiratory rate, because though the patient is presenting for diagnosis of cervical cancer, that is the determination, right? But while going through all this, you might pick some other more serious emergency related cases, and then you address that first before you go further to have your diagnostic procedures. For example, if you pick rapid pulse and you have your EKG and it's AFib, we have to address that before we move on to have cervical cancer diagnostic procedures done. Now, physical examination will include bimanual pelvic examination under anesthesia. That's why the history of anesthesia reaction in the past will be helpful. Speculum cervical examination. The pap smear reports obtained in the past, we must have a copy. If she has never done any, then we have to take one today. Can be followed up with colposcopy, depending on the outcome. When colposcopy is to be done, we will apply acetic acid to help with visualization, but a better view will be obtained when we use Lugol stain, that is Kira's test. What are we looking for? We'll be looking for acetyl-white lesions, punctation, mosaicism, and abnormal blood vessels. Acetyl-white epithelium will be suggestive of the presence of human papilloma virus. Then, we embark on biopsy as it is appropriate. Endocervical curettage or loop electrosurgical excision procedure. Punch biopsies could be done from posterior to anterior, but it will be helpful to have Moselle solution to help in hemostasis, to secure hemostasis to prevent bleeding. Endocervical curettage is contraindicated in pregnancy, but it is the gold standard. You can check my channel for Pap test or Pap smear in pregnancy. I've stated what could be done and could not be done there. Diagnostic loop electrosurgical excision procedure will be helpful. Cold knife conization if cytology suggests that we are dealing with glandular abnormality. Molecular testing could be done to get down to the specific gene. And also, you can have human papillomavirus DNA testing done. To the women who will choose to have human papillomavirus DNA testing done with cytology, that is Papa-Nicolau test, then the frequency of testing will be reduced to once in every 5 years. Okay, we'll head to the lab to have beta human chorionic gonadotropin done in every woman of childbearing age, regardless of whether they are pretty sure or not sure of their menstrual flow or menstrual cycle. That would be helpful, right? Complete blood count should be done. Want to know whether anemia has set in or there is infection going on somewhere? Liver function test, renal function test, have vaginal swab, microscopy culture and sensitivity, nucleic acid amplification test, or to rule out other associated sexually transmitted infections. Tumor markers, but note this is not diagnostic. Tumor markers will be helpful in monitoring and detecting recurrence. So, it is fine to have serum squamous carcinoma antigen, tissue polypeptide antigen. Still on tumor markers, you can have carcinoembryonic antigen and cancer antigen 125 or CY-FRA21-2. So all these will be good, but not for diagnosis, just for monitoring and also determine whether there is reoccurrence or not. Can I have ultrasound? Abdominal ultrasound. We want to see what is happening to the liver, to the pancreas, to the structure there, to the kidney, and of course pelvic ultrasound. Now, radiologically, you can have CT done, magnetic resonance imaging if you are fortunate to have that in your center. X-ray could be done. In all these cases, we are trying to rule out possible metastasis, right? The view of the kidneys, ureter, and bladder will be done using intravenous viogram. Positron emission tomography will be helpful. Now, in these radiological investigations, your focus will be on pelvic region, the spine, the chest, and abdomen. Endoscopy will be helpful. Sigmoidoscopy to see what is happening to the sigmoid colon. Proctoscopy to know what is happening to the rectum and anus. And cystoscopy to know what is happening to the bladder. To anyone who is confused, you can check my channel for other presentations on cervical cancer, you will know that by the time you check the staging, you will know that it can spread to all these structures. After you've made your diagnosis, you've done your staging, you've now embarked on treatment, and the patient is already treated, you can have now follow-up tests done besides the tumor markers. You can have some radiological investigations, you can have CT done, but if you have the resources, you can have PET done, positron emission tomography. That could be done within 3 to 4 months post-therapy. With that, I've come to the end of how to make diagnosis of cervical cancer. You can check my channel for cervical cancer signs and symptoms, for risk factors, for Pap smear or Pap testing, human papilloma virus testing, Pap testing in pregnancy, and now how to make diagnosis of cervical cancer. Thanks for listening. Remember to share, remember to subscribe. I appreciate it.